हेलो फ्रेंड्स, वेलकम बैक टू माय यूट्यूब चैनल। इस वीडियो में हम एमएससी जूलॉजी फोर्थ सेमेस्टर का फर्स्ट पेपर न्यूरोफिजियोलॉजी एंड जर्नल फिजियोलॉजी सब्जेक्ट का टॉपिक द कैर्नियल एंड स्पाइनल नर्व का स्टडी करेंगे, जिसका इंट्रोडक्शन। द नर्वस सिस्टम इज वन ऑफ द मोस्ट कॉम्प्लेक्स एंड वाइटल सिस्टम इन एनिमल, responsible for controlling and coordinating various functions of the body. It is divided into two main parts, the central nervous system and the peripheral nervous system. The cranial and spinal nerve form an integral component of the PNS, facilitating communication between the CNS and other parts of the body. This document provides an in-depth exploration of cranial and spinal nerve, including their definition, structure, functions, and significance. Definitions: cranial and spinal nerve are peripheral nerves that emerge from the brain and spinal cord, respectively. Cranial nerves are responsible for connecting the brain to different parts of the head, neck, and thoracic region, while spinal nerve connect the spinal cord to the rest of the body. Together, they enable sensory and motor communication between the CNS and the peripheral tissue. Cranial nerve definitions and number. Cranial nerve are a set of 12 pair nerves that originate from the brain and brain stems. Each nerve has a specific function, such as sensory, motor, or mixed, both sensory and motor. Classification and functions. The cranial nerves are numbered using Roman numeral 1 to 12. Based on their position from front to back, they include: first, olfactory nerve, sensory nerve for smell; second, optic nerve, sensory nerve for visions; third, oculomotor nerve controlling most eye movement, pupil concentrations, and lens shapes; fourth, trochlear nerve, motor nerve for eye movement, superior oblique muscles; fifth, trigeminal nerve, mixed nerve for facial sensation and chewing movement; sixth, abducens nerve, motor nerve for lateral eye movement; seventh, facial nerve, mixed nerve for facial expression, taste, and salivary glands functions; eighth, vestibulocochlear nerve, sensory nerve for hearing and balance; ninth, glossopharyngeal nerve, mixed nerve for taste, swallowing, and salivations; 10th, vagus nerve, mixed nerve that influences heart rate, digestion, and respiratory rate; 11th, accessory nerve, motor nerve controlling neck and shoulder movement; 12th, hypoglossal nerve, motor nerve for tongue movement. Clinical importance. Dysfunctions of cranial nerve can lead to disorders such as anosmia, loss of smell, blindness, facial paralysis, and difficulties in swallowing or speech. Accurate diagnosis and treatments are essential for restoring functions. Spinal nerve definition and number. Spinal nerve are 31 pair of mixed nerve arising from the spinal cord. They are categorized into cervical 8 pair, thoracic 12 pair, lumbar 5 pair, sacral 5 pair, and coccygeal 1 pair nerve. Structure. Each spinal nerve is formed by the union of two roots. First, dorsal root, second, ventral roots. First, dorsal root contains sensory fiber that transmit signals from the body to the CNS. Ventral roots contain motor fiber that carry commands from the CNS to the muscles and glands. The two roots merge to form a mixed nerve that branches into dorsal and ventral rami surviving specific region of the body. Functions. Sensory functions transmit sensory information such as touch, pain, temperature, and proprioceptions to the CNS. Motor functions control voluntary and involuntary movement by innervating muscles and glands. Reflex actions facilitate quick response to the stimuli without direct involvement of the brain as seen in reflex arc. Plexus. Spinal nerve from network called plexus to ensure redundancy and comprehensive innervation. Major plexus includes cervical plexus supplies the neck and diaphragm. Branchial plexus innervates the shoulder and arm. Lumbar plexus supplies the lower back and leg. Sacral plexus innervates the pelvis and lower limbs. Differences between cranial and spinal nerve. Feature cranial nerve and spinal nerve. Feature number. In cranial nerve there are 12 pair of cranial nerve and spinal nerve 31 pair. Origin. cranial nerve ब्रेन एंड ब्रेन स्टेम्स एंड स्पाइनल नर्व का ओरिजिन होता है स्पाइनल कॉर्ड्स. फंक्शंस सेंसरी फंक्शंस मोटर और मिक्स्ड फंक्शन. स्पाइनल नर्व ऑलवेज मिक्स्ड. टारगेट रीजन ऑफ cranial nerve head, neck, thorax and spinal nerve target region whole body below neck. Plexus formed in cranial nerve rarely example vagus nerve and plexus formed in spinal nerve frequently example branchial plexus. Clinical significance. Disorders of cranial nerve conditions such as Bell's palsy, trigeminal neuralgia and vestibular neuritis arise from cranial nerve dysfunctions. Early detection and interventions are crucial. Disorder of spinal nerve. Issues like sciatica, herniated disc and spinal stenosis affect spinal nerve. These conditions can cause pain, weakness or numbness and often require medical or surgical management. Third, role in reflexes and responses. Both cranial and spinal nerve play a vital role in reflex actions, enabling survival through quick involuntary response to stimuli. Conclusion. Cranial and spinal nerve are essential components of the peripheral nervous system, facilitating communication between the central nervous system and the body. Cranial nerve primarily serve the head and neck, while spinal nerve extend their influences to the trunk and limbs. Understanding their structure, functions, and clinical relevance is crucial in fields like medicine and urology, as it aids in diagnosing and treating various neurological conditions. References.